Hello and welcome to another episode of the SITREP. Today we're talking different aspect of mental health. We're talking about PTSD, bipolar, therapy, all different types of topics. And today we are joined by Dr. Meg Martinez. Meg, thanks so much for joining us.
Happy to be here. Thanks for having me.
So Doc, probably one of the scariest sounding therapies that are out there is exposure therapy. What is it?
I agree. Exposure therapies, they have a bit of a bad reputation. I personally think exposure therapies are great. I think they're great fun. And it's not because I'm a sadist. It's because they really work. So exposure therapy is a hallmark of many cognitive behavioral therapies. And it's an intervention that's targeted at that behavioral piece, right? Changing our behavior. So oftentimes when we're afraid of something or when we think that something is going to cause discomfort, we don't do it, right? We avoid it. So exposure therapy is at its core about changing that behavior, approaching what we might otherwise feel like we would prefer to avoid. And when we do that, a couple of different things can happen. One thing is that we realize, like, we kind of get used to it, the bad thing. The example I'll give often is, you ever walk into a room and there's a really strong odor and you're like, oh, that's...
Hopefully not an elevator.
Yeah. Like, that's foul.
Yeah.
Well, what happens the longer that you're in that room?
You become desensitized to it.
Right. The fancy term is habituation. You habituate to that stimulus. Same thing happens with everything, right? If you're in a situation long enough, you're going to get used to it. So that's oftentimes what happens in exposure therapy is people realize, like, okay, I can be in the presence of this thing that makes me really uncomfortable and it'll get better. I tell my patients, emotions obey the law of gravity. What goes up must come down. So I can experience that. I will feel anxious. My anxiety will peak and surge. And with time, it'll come back down. I will say it doesn't always happen that way, but many times it does. Even if you don't experience that habituation, though, there still is a benefit to exposure therapy. And that is that you have the opportunity to learn something new. I tell my patients all the time, you keep doing what you're doing, you're going to keep getting what you get. But if you take a chance and do something different, you have the opportunity to learn something new. Like, maybe this thing isn't as scary as I thought it would be. Or maybe it's not, maybe the likelihood that something bad is going to happen isn't as high as I believed it would be. Or maybe I can handle it better than I thought I would. And when you open the door to that new learning, there are all sorts of new possibilities that can emerge.
I'm sure some people in the audience, heck, I'm even thinking about it myself. I mean, I guess doing exposure therapies, it's tough. It's tough work, especially in the very beginning. But does it inflate or increase the frequency in which I might have other symptoms like bad dreams or that kind of stuff? I mean,
yeah.
Is that expected? Does it happen?
It can. And I will tell you that most of the time, it doesn't happen that way. It's possible that sometimes people have sort of an initial surge of symptoms, they feel a little bit worse before they feel better. More often than not, though, people are already feeling pretty bad. Like, what we don't realize is that avoidance actually takes a lot of work. It takes a lot of work to try and minimize discomfort and to redo all of our routines to, lower the likelihood that we encounter various anxiety-provoking stimuli. So sometimes there is a little bit of relief, most of the time, a little bit of relief that comes with just ripping off the Band-Aid. And I will say, generally, we don't sort of drop people in the deep end of exposure, right? We don't say, okay, what's the thing you're most afraid of? Now go do that. We are generally taking a more graduated approach where we're sort of working up to, starting with things that are mildly anxiety provoking and working our way up to the scary things so that people can start to feel more of a sense of mastery and accomplishment.
Yeah, another movie reference. What about Bob?
Yeah.
Baby steps, right?
Baby steps.
Taking baby steps.
That's what we're doing.
Doc, thanks so much. And for anybody in the audience that's looking for additional information on this topic, be sure to check out the video description below.
Hey everyone, connecting with your benefits is our primary mission, and the SITREP offers more options than ever. Subscribe to our email newsletter, subscribe to our podcast, or subscribe here on YouTube. For details and links, check out the description below.